Good afternoon, everyone, and many thanks for being with us today. My name is Ettore Greco. I am the Executive Vice President of the International Affairs Institute, Istituto Affari Internazionali, and I am very glad to open this meeting dedicated to a very topical subject, health product manufacturing in Africa, towards pandemic preparedness and equity. The meeting has been organized by our institute with the support in cooperation with Focus Equality, and I'd like to stress that we are attached great importance to this partnership with Focus Equality. And indeed, Focus Equality is helping us a lot to advance our understanding and study of health issues. So we are very grateful to the Focus Equality team for their support and cooperation. The goal of the meeting is, in a nutshell, to examine and discuss the main problems and factors that prevent or limit the access to health products, focusing on African countries, which, as we all know, are particularly vulnerable to health threats and lack largely the structures and capacity needed for an effective pandemic preparedness. We want in particular to look into the various initiatives and programs undertaken at various levels, at the national, regional, and also global level by different actors to promote the production of health products in Africa. This implies examining the shortcomings and potentialities of those initiatives, what they have achieved so far, how they can be improved and adapted to deal with the emerging challenges, including possible enhancement of the available institutional instruments. As you know, a variety of institutions and programs are indeed active in this field, so it's also important, and probably not less important, to discuss if greater synergy and coordination can be created among them. As you may have seen, the panelists include experts from many leading institutions and programs, but also civil society organizations, who will offer a variety of inputs and perspectives. To all of them goes our heartfelt thanks for accepting our invitations. We wanted to have a dialogue with the main relevant stakeholders. I think the meeting's agenda reflects this effort. In the first session, we'll focus on the challenges, particularly the structural obstacles and difficulties in creating an industrial capacity for health product in Africa. In the second session, we will rather concentrate the discussion on the ongoing programs and initiatives to identify the ways and means for making them more effective. Of course, this distinction may appear and is in fact rather artificial, so feel free to raise any issue at any time you consider relevant. My colleague Irene Paviotti has drafted, I think, a quite interesting and inspiring paper, which provides an overview of the issues associated with the implementation of the global health agenda, and more specifically the goal to equip African countries with the health product capacity. I believe the paper highlights a number of critical questions, including some stumbling blocks that need to be addressed. The paper also illustrates the various ongoing programs and initiatives, but also make a number of suggestions and proposals. Those suggestions and proposals are addressed in particular to the upcoming Italy presidency of the G7. Indeed, we believe that the G7 can do more, as an important role to play in supporting and promoting the existing programs on global health and provide a forum for discussing crucial questions, including vaccine production, technology transfer, and of course, financial support, the various forms of possible financial support, and how they can be increased, and also the channel to provide those support can be streamlined. All these, all issues that should be at the center of the G7 development agenda. Africa, we know, will be the regional focus of the activities of the G7 presidency. So, of course, the best way to develop this regional dimension would be to dedicate specific initiative to those problems that are of vital importance for Africa, that we think should be given higher prominence in the G7 deliberations. Let me mention in that regard that our institute has received from the Prime Minister Office the mandate to co-chair, together with the Milan-based Institute ISPI, one of the official engagement groups of the G7. The name of the group is T7, Think 7. It brings together a large network of study centers and experts working on the global governance agenda, in particular the G7 agenda. In that framework, we will organize next year events specifically devoted to discussing the role of G7 in advancing the global health agenda. So we think this meeting should be just a first step of this process. Let me stress that we very much look forward to remaining in touch with all of you. It's our firm commitment to involve the wider possible participation of decision makers, stakeholders, and civil society organizations. I thank again all of you, all the panelists and participants for being part of this meeting. And I have now the pleasure to give the floor to Francesca Belli, Director of Focus Equality. Francesca, you have the floor.
Thank you very much. First of all, I want to thank you all the panelists that take the time and take the energy to share all the knowledge, also in preparing the report that you will see. So the report is, the idea of the report is more like to make a picture of what's happening now in the framework of the health product manufacturing. Why we decide to work on this picture, on this specific issue, because it's an issue of preparedness and equity. So, and also because it's one of the issue that for the moment is at the heart of the global health agenda. In particular, is the center of the G7 agenda. The debate around the health product manufacturing started in 2022 as a follow-up, I would say, as an output of the COVID crisis. So the G7 presidency in 2022, for the first time, integrated the issue of health product manufacturing as in the framework of PPR, so the preparedness for the pandemic. And in 2023, so this year with the with the Japanese presidency, the G7 Health emphasized the importance of partnership and have an holistic approach through this issue. And also the way that we think about this event is really an holistic approach. Try to put together some of the most important organizations that have a role and they can really share expertise and best practice, both about procurement and market shaping, but also about regulatory and quality assurance. And again, the G7 leader communique in 2023, so in Hiroshima this year. Again, said that it's important to invest in global health through vaccine manufacturing capacity worldwide. So now, today, the legacy is to move forward on this specific issue, keep the global health agenda high in the global agenda, because we are in the middle of a very changing environment, and it's very complicated to move forward on this specific issue. There is, after the COVID pandemic, there is the risk of panic and neglect. So we experience all why it's important to invest in global health, but also we forgot very fast why it's important to invest in global health. So this event has the scope to, I hope that one of the most important delivery of this meeting is to develop this, to put the global health high in the agenda, but also develop a platform of factors that work together on this specific issue. And so now I leave the floor to the specialist, and good meeting to everybody.
Well, you said the specialist, so I thought it was not me. Thank you. Vice President Greco, Director Belli, distinguished audience, panelist, Director Manno. Let me first of all thank you very much for this invitation to participate in this event dedicated to the health product manufacturing in Africa. I would like to commend warmly Istituto Affari Internazionali for organizing this event, which I would say is twice timely, because on one, at least in our view, because on one hand, it takes place shortly 2 months before the beginning of our presidency of the G7. And on the other hand, it takes place a few days after the approval by the government of Italy of the bill structuring the Piano Mattei per l'Africa. As you know, Italy announced a comprehensive plan meant to build a new partnership with the African continent based on shared visions, priorities, and strategies. The bill, recently approved, institutes a steering committee that will coordinate the Italian action in all areas of cooperation towards the sustainable development of Africa, including, obviously, health. On the Italian side, it is a whole-of-government approach in which also the private sector, finance, civil society, academia are called to participate and contribute. As Prime Minister Meloni said, there would be nothing new about presenting a plan to Africa. What is new is to write it together, set priorities, and implement a strategy. This initiative comes at a time of unprecedented multidimensional crisis. Wars ignited by ruthless aggressions that remind us of times we thought belonged to the past. More and more devastating effects of climate change that we see daily also in our territories. A pandemic that affected not only economic growth, but also our common efforts to pursue the Sustainable Development Goals, a task we had committed to in order to ensure a future for the next generations. The combined effects of such crises entailed a setback in the Agenda 2030 and presently represent a serious challenge for the international community, called to cope with several priorities competing for resources, and I would say for attention and consideration. But we cannot allow prioritizing sustainable development, as we cannot afford prioritizing Africa. Global challenges can only be overcome globally. This is even more true when it comes to health. As the pandemic proved, communicable diseases run faster today than in the past, and nobody is safe unless everybody is safe. Among the 17 SDGs, health has experienced great progress. As reported by the United Nations, great strides have been made in improving people's health in recent years. 146 out of 200 countries or areas have already met or are on track to meet the SDG target on under 5 mortality. Effective HIV treatment has cut global AIDS-related deaths by 52%, also thanks to our friends here, since 2010. And at least one neglected tropical disease has been eliminated in 47 countries. However, inequalities in healthcare access still persist, and much remains to do. I think that the 3 high-level meetings dedicated to health during the last United Nations General Assembly, the 78th session held in September this year, have been a great opportunity for world leaders to place health back on the high-level political agenda. As for Italy, global health is a traditional priority, both politically and in terms of development cooperation. Italy has prioritized global health within the G20 presidency in 2021, notably in the field of pandemic preparedness and sustainable health financing. The G20 Joint Task Force on Health and Finance was created back then and subsequently led to the institutionalization of the Pandemic Fund, of which Italy is the 4th largest contributor. Global health will surely be a priority of next year's Italian presidency of the G7 group, with a specific focus on global health architecture, long life prevention and healthy aging, and One Health approach, including antimicrobial resistance. In the multilateral arena, Italy is a strong supporter of global health-related funds, programs, and partnerships. We participate actively in the works of the WHO, the main multilateral organization in charge of global health, having in mind the ambitious goal of concluding the negotiation of an international agreement on prevention, preparedness, and response to future pandemic threats by May 2024. And we support its strategic preparedness and response plan. Already in 2006, we played a central role as president of the then G8 group in the setting up of a global fund to fight tuberculosis, HIV, and malaria, a partnership to which we have been contributing consistently since then, being as of today among its major public donors. In that very year, 2006, we became a founding member of International Finance Facility for Immunization. And since then, we are an important contributor and cooperator of Gavi. Particularly during the COVID-19 pandemic, our support to the coordinated multilateral effort has been effective and significant. Italy was among the first countries to support the creation of a multilateral pandemic response tool with the establishment of the Access to COVID-19 Tools Accelerator, including the COVAX facility aimed at accelerating the production and equitable access to diagnostic tests, therapies, and vaccines against COVID-19. In the field of vaccines, we also cooperate with CEVI, also recipient of important Italian contributions through multilateral pledges, to finance and coordinate the development of new vaccines to prevent and contain infectious disease epidemics. Italy devotes a particular attention to universal health coverage, also by strengthening locally health systems, especially in Africa, an area of strategic priority. And we are following closely the progress being made in devising mechanisms to incentivize African vaccine manufacturing. As to bilateral development cooperation in the health sector in Africa, the portfolio of ongoing initiatives amount to about 300 million euros. We operate in many African countries with a special focus on North Africa, Sahel, and the Horn of Africa. The projects range from support to local health systems to training of personnel, from capacity building to projects aimed at reducing maternal and infant mortality. We are convinced that more resilient, equitable, and sustainable health systems are the real safety net to protect the most vulnerable from emerging health emergencies. Italy is doing and will do its part. Thank you.
Thank you. Now it's time for the first panel, and I invite my fellow speakers to join me on the stage. Mr. Enrico Costa from the Italian Medicines Agency and Mr. Jack Ndengwa from Canco. No, please sit here. It's meant to be this way. We also have joining online, I think we can see her soon on the screen. We can see Mrs. Zimmerman Bonifield from the Center for Global Development. Can we see the picture on the screen? And since we have lots of things to cover during this panel and the next one, I will start right away. Well, I will just ask, maybe, can we have the picture on the, well, yeah, okay. So we'll just start asking questions, and then as soon as the picture comes online, we will see Mrs. Zimmerman Bonifield. We will focus in this first panel on the challenges and mainly the economic ones in terms of health product manufacturing in Africa. So boosting health product manufacturing capacity on the African continent is not easy. There are a host of obstacles that both manufacturers and governments who want to start or expand their business in this field have to face. So could you maybe talk about the supply side challenges that African health product manufacturers are facing in this landscape?
Sure, thank you. And thank you to IAI for organizing this great event. So there are many. It's a challenging business to be in, vaccine manufacturing, both technically and then also economically. And those are true everywhere in the world. And they are also true in Africa, where such businesses would be more in kind of startup mode. So to just go through a few of the challenges. So the first set of challenges is around sort of capital and investment to actually make the facilities and have the upfront costs. So these are capital intensive facilities. You need to do a bunch of upfront investment in the actual, the equipment, the people that you need to bring in to set things up. And getting that upfront investment is not necessarily an easy feat, especially it depends a little bit on what your go-to-market plan is and what you see on the other end, but these are large upfront sums of money that need to be put in from the beginning. So getting the loans or grants or capital support to do so, quite important. A second element on the supply side is around intellectual property and technology transfer. Depending on the product that's being manufactured, this might be important. Not for everything. So for small molecule generics, this is something that probably most generic manufacturers can figure out to do for themselves without technology transfer. But for vaccines, for biologics, for some of these more complicated health products, getting the support of an originator to actually develop the product and to do the technology transfer or some other intermediary is quite important in actually having the capacity to know the recipe, essentially. And this all needs to be coordinated. In addition is the intellectual property part of this. So technology transfer is the actual sort of teaching of how to do it, but some or all of that IP might be protected. So trying to navigate the landscape, secure a license if something is still under patent can be quite complex. Then there's the sort of soft supply constraints, which I would describe as equipment, the components of different products, so raw ingredients, API, the trained people who actually will work in these facilities and do the things. And this all needs to happen quite economically. So for African, this gets into the demand side, But ultimately, these are buildings that businesses and activities that have very large economies of scale. And generic companies and vaccine manufacturers in India, for example, operate at tremendous scale and therefore are able to keep the unit costs quite low. So to ensure that you are able to actually, get the people you need in to do the activities, to get the raw materials, the API, the components, and to do so at a cost that's going to be somewhat competitive on the global market is very challenging if you're not operating at the same scale that maybe some of these Indian manufacturers are. So I'll pause there, but I think it's safe to say that it's not a simple business to get into. And none of these things are Africa specific. These are the challenges, broadly speaking, with starting up businesses in this space. It is not an easy field to be in. And it's very important that Africa enter it, but it's not an easy task. Thank you.
Thank you. This is a great overview. And something crucial that often gets overlooked in these discussions about health product manufacturing is the standards that health products need to meet in order to be marketed, and the institutions that need to certify that these requirements are met. So, Mr. Costa, could you please elaborate a little bit on the role the regulatory frameworks do play in supporting the African health product manufacturing sphere, and more broadly, how regulatory frameworks help broaden access to health products in general?
Okay, thanks. First of all, thank you for the invitation. Can you hear me? Yeah. Thank you for the invitation, and let me congratulate on this intriguing report that you drafted. Regarding your question, yes, there is a general tendency to look at regulators as an obstacle to access the market, but rather than considering them as a gatekeeper to protect public health. And there is no doubt that strengthening a reliable regulatory system can pave the way for further improvements in drawing investments to improve local capacity and manufacturing. So, for example, on the other way around, we can just see that with the lack of such system, Africa depends on external imports and support, so that can set up their own global agenda. And now we are experiencing a very interesting, intriguing period as over the past 10 years, we have been Africa actually has been working in harmonizing several regulatory framework that are set at regional level. And 4 years ago, before COVID outbreaks, the African Medicine Agency was set up in Rwanda. This is a very turning point, and maybe it could be a game changer for the whole African continent. And as a European, we look at it as a unique opportunity to support the implementation of the African Medicine Agency. Of course, we should also acknowledge that drug regulation is not just to overlook standards, but encompasses a lot of initiative and practice, from ensuring quality to assess effectiveness to the pharmacovigilance once the product is on the market. Of course, setting a reliable framework is not itself, it's just a precondition. It's not the solution to improve access at local level, which it's a very more complex and multidimensional phenomenon, which requires different investment at decision-making policies. For example, to line up priorities, investments, and a public health and also a clinical literacy. And so we are, in this case, very fond of supporting such initiative to transfer a know-how and a literacy in the continent.
Thank you. And so we have seen very broadly the supply side challenges in boosting health product manufacturing in the African continent, but demand is equally important. It's like the other side of the equation. So I would like to ask you, Mr. Ndengwa, since you have interacted with government and non-government stakeholders in the sphere, could you share with us what is the current state of demand for such products in Africa?
Thank you. Thank you, Irene, and thank you for that question. I'm glad you're asking me about the demand, not the challenges. And I look at the question of demand from three levels. One, I look at the growing population being the first key factor. And the second one, I'm going to talk about specific disease outbreaks, especially the ones that are unique within the Afro context. And I think the third one, I look at the absorption of the technologies, the medical technologies that are coming, health product and vaccines. And we can use vaccines as a good example, especially within the Afro region. Starting with the first one, growing population. Currently, Africa has about, has about 1.34 billion. That should be 2020. In terms of population, I think as of November, I saw the statistics 2021 moving to around the first one is 1.34, the next one is 1.38 as of November. And again, if you take that population moving to 2030, Africa is estimated to have about 1.78 billion people. Moving to 2030, and I end there in terms of population, you're basically talking about 2.5 billion people. But then the conversation is very interesting because if you look at where we are about 1.34 billion people, 99% of vaccines come from outside. So that means the first place, there's a population that is available that is ready to consume the various health products. Again, pick the birth cohorts. If I can remember statistics, 2020, we are talking about 43.6 million children being born annually. And I think with that, we know how Gavi feels about that. I mean, we get to see that. So the population itself, dynamics are quite interesting. It is growing. And currently, it is the second most populous continent after Asia. So there's already a demand for this health product. I know that. The second part, which is quite interesting, is the discussion around specific outbreaks that are, I would say they are kind of unique in the Afro context. And with some of these outbreaks, we do have, say, for example, if I was to use the vaccines for them, others we don't have. Take malaria. The incidence rate is about 5.7% in the Afro region. Typhoid, and I'm glad by now we do have malaria vaccine RTSS with the support of various players. A few countries are already piloting. We have Kenya, we have Ghana, we have Malawi, if I'm not wrong. Yeah, so that's just one case. Malaria is quite unique in our context, and we do have a lot of malaria outbreaks. We have other outbreaks like the Zika virus. We do have chikungunya. We do have typhoid. We have cholera. We have various outbreaks that are much more unique in the Afro context. Look at meningitis, and I'm glad that we have meningitis vaccine, MEN-A. Look at the meningitis pandemic, the belt in the northern part of Africa, about 26 countries. That's quite unique. So if you look at the history again of the outbreaks, especially in the Afro context, one, we do have vaccines that are already and in the market, supported by various players, Gavi being one of them. And we have new vaccines that are not yet developed. But then with these outbreaks, the uniqueness of the new vaccines that are being developed. And even within that peak, even HIV pandemic in the Afro region, I think by 2018, we had about more than 24.8 million people on ARVs. In fact, in the Afro context, 2/3 of new infections around 2018 globally were from Africa. Look at now the potential when we're likely to have AIDS vaccine, TB, and the work that is being done around TB vaccine. And Africa, somehow a quarter of TB cases are in the Afro region. So we do have an opportunity around the outbreaks, whether the vaccines that are development or already the vaccines that are already out. So that talks about the demand for some of these medical products and all that. And I think the third part for me is, which is quite interesting, is that we are seeing currently quick uptick of new fast technologies, medical products, and vaccines. From the year 2000, Gavi has vaccinated more than 531 million children in Africa. If again you go deeper around all that, you'll see that most countries' uptake of DPT-3, or let me use the word fully immunized, children, is about 80%. This is talking about the demand for vaccine. This is talking about the demand for these products. So along the way, the uptick gets very, it gets very interesting to look at from the 501 million Gavi has been able to vaccinate, and that is mostly within the routine. But again, we were just looking at the statistic recently, and we realized that that is not inclusive of, for example, HPV. It's not inclusive of the potential for malaria vaccine. And if you are to include then malaria vaccine, HPV vaccine, it's likely to move beyond 700 million doses. So how is, the demand? That creates a bit of demand and all that. And moving a little bit backwards, just remembered something around, the outbreaks and all that. Under the new vaccines that are, for the disease outbreak, Africa, it has been projected like by 2025 that will need about 142 million doses of diseases, that we refer to as outbreaks and all that. So in terms of the market, it's very clear. It is available. It is there already. The demand is there. And I think the various players, Global Fund, Gavi has been able to trigger that demand, and it's kind of working very well. So there's already demand for it. So the epidemics are going to be a major driver, or outbreaks still a major driver for demand, the general population, and also acceptance of some of these medical technologies and products in the Afro context. Thank you.
Thank you. These numbers are really, really helpful. And every time I think about demand, I also think about the broader macroeconomic context in which we are operating, but also many African governments are operating, meaning that policymakers increasingly have to choose between paying debt or financing their healthcare and vaccinating their populations. So Mrs. Silverman-Bonifield, I wanted to know how do you think this current broader macroeconomic context of choosing between debt and health financing, what does it mean in terms of the sustainability of initiatives that are being designed and proposed to tackle these supply and demand bottlenecks? And given the circumstances, what considerations should be made when such initiatives are designed?
Yeah, it's an excellent question. Thank you. So I think the key question for the sustainability of all of these initiatives comes down to who the buyer is going to be in the long term. So in the short term, you have, Gavi making moves that it is going to have some commitment to purchase African-made vaccines. You have the Global Fund looking to buy more from the African continent. But these are temporary measures. These are probably, in the long sweep of history, temporary bodies. Temporary, hopefully, decades longer, but they will not be there forever. And already African governments are the ones who buy many of the health products that serve their populations. And not just African governments, by the way, it's also private wholesalers and importers who are buying on behalf of the private sector, which makes up a majority of health product sales in many African countries. So the question is, will African manufacturing be cost competitive with the cheapest other available products on the market, or will it not be? And I think it's going to be quite challenging to get to cost competitiveness in the short to medium term because of what I was saying earlier about the startup costs of all these facilities, because of the challenges in operating at the same scale as some of the largest Indian manufacturers. And, you know, what we seem to see from Gavi, for example, is that they're expecting to need to pay a price premium to support African vaccines, at least in the short term, of something on the order of 30%. So if in the short term, these vaccines are not cost competitive, who is the consumer, the buyer, who's going to be willing to pay the price premium? And the obvious question that then becomes, you know, are African governments, who are very rightfully demanding that there be increased capacity on the African continent for these products, are they willing to put the price premium behind that to support the purchase of locally produced products? And in a fiscally constrained setting, that's going to be very difficult to do. I mean, it's difficult to do under the best of circumstances because all money has trade-offs, and making the choice to spend more on something purchased locally is always going to be contentious. I'd say all the more so if it is something purchased locally on the African continent, but not necessarily locally within the specific country. In which case it's hard to even make the argument to your people on, you know, economic development and industrial policy grounds that this is a good investment for local jobs and economic output. And the more fiscally constrained the governments are, the more challenging, the larger the challenge they're going to have just covering basic health expenses, the more difficult it's going to be to make that argument that they should be paying the price premium for locally produced products. So, you know, it's a tough question. I mean, I think these are all very legitimate policy goals and important ones. But I think in this particular fiscal context where already there's not enough money to even sustain current health spending, far less grow the pie, making those choices to spend more than the cheapest available price for some of these health products is going to be a challenging sell. Thanks.
Thank you. Sobering, but painfully true. So the long-term perspective is what we have to take now. Dr. Costa, as you mentioned, investment in health product manufacturing is conditional on the existing regulatory frameworks, hence the importance of operationalizing the African Medicines Agency. So I was wondering, how is the Italian Medicines Agency supporting the development of regulatory frameworks in African countries, either at the continental level or also a national level?
Well, actually, we are in early days, and of course, we are the Italian Medicine Agency is a national competent authorities for drugs for human use. Vet medicines and medical devices are not in our remit, but are in those of the EMA. And the EMA and our activity is strictly related and embedded in the European Medicine Agency operations. So in this coordinating framework, we are trying to engage some project, of course, with African counterparts. While the European Medicine Agency is about to start improving the operation of the African Medicine Agency, we are discussing with them to address our efforts on a lower level, which is still important, of course, to improve know-how, because Africa, the regulatory framework is also coordinated by the Agency of the African Union, NEPAD, and the 8 regulatory centers have been implemented throughout Africa. So there are very important targets to address, as around these centers, many academia and research center and national authorities try to work together. So We don't want to implement our own projects just to stay on the table in the international context. Rather, we would like to identify and work together with the African counterparts, so the ARCOR centers, to set up the most suitable projects. So we would like to provide some seeds that can blossom in the future at more cultural level to be operative on the long term. Of course, these require substantial efforts, not just from an economical perspective, but also for our capacity in Europe. But we are confident that we can, this is the only recipe to improve, to provide a future for the Africa healthcare system. Jackson before said that outbreaks are major drivers of decision policies, but I also think that this is why this happened, because in some places some public health perspective are not so strengthened to provide the long-term perspective for not only targeting communicable disease, but also non-communicable diseases that are very that are a huge burden for Africa. Taking an example with malaria, sickle cell disease is one of the major prevalent diseases in Africa. Now is reaching high-income countries due to migratory fluxes, and now we are here approaching new therapies such as gene therapies that are absolutely unaffordable for are not affordable at the moment for we Europeans, but in Africa will be completely unaffordable for the prevalence of disease. So these are the new challenges we have to tackle in the future, because the scientific and regulatory scenario is quickly evolving, and we can't cope with all the approaches. We have now to figure out how to deal with the new therapeutic options that are completely different from the past, which target high prevalent diseases. In the past, we had drugs targeting very wide populations, but with I can say less effective. Now we have very effective drugs for small populations, very identified by molecular targets. So the point is how to use these drugs in a context when in most of the cases you have wars, in most of the cases you don't have electricity, in most of the cases you don't have molecular diagnostics to try to use these drugs. So it's very challenging. And we have the ethical imperative to try to use the most effective drugs and not to abide, if you want to abide to our ethical commitment to provide the best options to the population.
Thank you. And just to complement this panel of theirs called multi-stakeholder perspective. So we heard a kind of, agency perspective, government agency perspective, but civil society is also very important in this sphere. So Mr. Ndangwa, I was wondering, could you maybe illustrate a bit more what role civil society can play in designing such initiatives that respond to the people who need these treatments and diagnostics and cures the most across the African continent, so to ensure broader access to healthcare?
Thank you, Irene. The civil society has a big role in ensuring that the health products are available. But let me start. The first thing is that the civil society are very keen in creating demand. My organization, I work with a Kenyan NGO that I work very closely with Global Fund and also Gavi. From up to 2020, we were tasked by the Ministry of Health to work in partnership with UNICEF and WHO, the Ministry of Health, to create demand for vaccines and immunization, funded by Gavi, the Vaccine Alliance, through the Health System Strengthening Grant in about 17 counties in Kenya, just to create demand for these vaccines. Sometimes you find in our context, the problem is not the supply, the problem is the demand. So it becomes very important for non-state actors and communities to create demand. You can just imagine the work that is being done by Global Fund without the civil society. In our context, in the Afro context, we usually have two primary recipients of Global Fund grant. We have the state as one of them that will deal with the health system, will deal with procurement of drugs and all that. But we also have a second, what we refer to as a second PR, primary recipient, which is a non-state actor, which works mostly with the civil society to look at how to reach the community interventions and all that. The civil society are often in touch with the realities on the ground, and they know how to reach the community that they serve quite well. So demand generation becomes one of the key for all these health products, especially in our context. Then the other important aspect is the discussion that is currently taking shape, community-led monitoring or social contracting. The civil society are very key at highlighting issues around any drug, any commodity, issues related to affordability. How affordable is that specific drug or vaccine or medical product? How available is it? And what is the how is the quality in terms of provision and all that? So those three areas becomes very important in terms of looking at community-led monitoring, because the communities are basically able to monitor how these products and services are being offered along the way. And especially if you look at the discussion, especially in the Afro context around the key populations, it becomes very difficult for government to target key populations, men having sex with men, female sex workers, people who inject drugs, becomes difficult in our context. And we have seen certain countries that are even legislating against that. So it becomes difficult for such countries to be reached with government services. Non-state actors or community-led organizations becomes very key to be able to deliver services, and also at the same time advocating for availability of these drugs, medical products and commodities to the communities. Now, and again, the third part is advocacy in the Afro context, looking at policy frameworks, how they need to be, looking at the issue of resources, budgets, advocacy with members of parliament, with governments, to make sure however much these products are either available and being purchased, but again, the whole delivery mechanism need again to be supported with the right frameworks and also the right resources. If you look at the Afro context, investment in R&D by most African countries is very, very limited. In fact, it's just like, I would imagine like South Africa, quite, they're investing, still not yet there, but they are kind of investing much more better. And a few countries, especially in North Africa, and this is whereby you have, countries like Egypt, Algeria, that some of them are, working and have some vaccines manufacturing plants, which mostly, again, is fill and finish and labeling. It's very difficult to find. It has become a bit difficult to find, for example, in the Afro context, a country that has been able to embrace a whole end-to-end, production for vaccines. So that speaks a lot about the need for advocacy by non-state actors within the region. And I think R&D then provides a very good case whereby we need to advocate and push for more. And non-state actors are really also working and pushing, for example, for funding of, TB vaccines, HIV vaccine. The discussion has been there, making sure the communities are part and parcel, in terms of pushing for that. Again, if you look at, for example, the case of HIV in the early 1990s, it was really the communities, non-state actors they had to do a lot of pushing to make sure that there's availability of ARVs, and also at the same time, they are kind of available. So the non-state actors have a big role in civil society, in advocacy, in creating demand, in ensuring they're monitoring the availability and services, and also at the same time program across the board. So it will be very difficult to do away in this equation with non-state actors. And also a good example also to focus on recently is COVAX, led by Gavi, CEPI, WHO, but the role of non-state actors being, available to give, to provide kind of insight into how COVAX should work, especially reaching the community becomes very important. So the non-state actors will find it difficult, or will be very difficult to have a clear program that is targeting the community without involving the non-state actors. Thank you.
Thank you. Thank you to all the three of you for answering these questions. And this was really just to provide an overview. So I would like to ask Mrs. Vani, the Global Fund procures almost $2 billion on HIV, tuberculosis, and malaria products each year. So what do you do to secure supply chains and ensure that affordable and quality assured products are accessible to the population?
Yes, thank you so very much. Very happy to be here. Thank you to Istituto de Affari Internazionali e Focus Equity for organizing such an important event and such an important subject. And congratulations on the excellent policy report, by the way. And thank you also to Italy for the commitment to global health and the support to the Global Fund since our birth, more than 20 years ago. Indeed. And we're also very encouraged by the G7 presidency agenda that is putting such critical matters as part of the priorities next year. So we are very encouraged by that. So before I talk about what the Global Fund does in that space, perhaps why it matters. Yeah, and many of the speakers have said it already, but really COVID-19 was such a stark reminder of the global health inequities. And for us at the Global Fund, it was a bit of a second trauma because it reminded us of what happened 20 years ago when HIV antiretroviral treatments were available only for rich people in rich countries and not for the rest of the world. So we really didn't expect to go back to some similar situation in 2020. And it was very, obviously very sad to see Africa last in the queue to access not only vaccines, but actually treatments, diagnostics, protective equipments, and everything that was needed to save lives. So it's quite right that African leaders, but also at this meeting today and the G7 next year, are focusing on such important issues, because we don't want to, as Francesca said earlier, go back into the panic and neglect cycle, and the world becomes very busy with all the other crises, and we don't act upon the lessons of the COVID-19 crisis. Let us never waste a crisis. Let's make sure that we do better next time. So the Global Fund, obviously, you mentioned we are one of the largest global health products procurers in the world for HIV, TB, and malaria, but also for COVID-19 related products, and that gives us a particular, I guess, power, but also particular responsibility, as we have, in a way, the ability to help shape the market in a way that is more equitable and more sustainable. But before I get there and explain a little bit what we do in that space, we consider the equitable access to quality assured products as a prerequisite to end AIDS, TB, and malaria. I mean, we cannot do without that, but it's also a prerequisite to the pandemic preparedness and response agenda, right? It's really at the heart of the existing disease, but also the emerging global health threats that might come in the future. So I mentioned our scale. So last year, for example, we procured $1.75 billion worth of health products through our pooled procurement mechanism. So that allows us, obviously, to help shape the market, and the market shaping ability of the Global Fund has been recognized 15 years ago. It's been part of our endeavor for so many years. But last year, we've sort of refreshed it, and we have now a next-gen market shaping approach that is much more dynamic, much more ambitious, and much more flexible to a fast-evolving landscape. So just to outline what the objectives are of such a such a framework, such an approach to market shaping. One, it's about reducing barriers to health product availability and affordability. Both, they need to be available and at affordable prices around the world. Secondly, improving the responsiveness and timeliness of health products service and delivery. And thirdly, promoting overall resilience and sustainability of in-country supply chains, right? And that's also super important. It's obviously globally, but it happens then at national level. So all of those objectives obviously have something to do with promoting capacity building for regional manufacturing, and that's very much at the heart of what we do. A couple of things to mention around this approach before I speak about how it's progressing, because we're obviously already rolling it out. In terms of what drives us, obviously our partnership model. So nothing that we are doing in that space is the Global Fund itself alone. It's obviously leveraging all of the partners' expertise and engagement, and very much leveraging the model of the Global Fund, country-owned and inclusive, including of civil society and communities. It's been mentioned before. So quickly about some of the early market shaping outcomes in that space. We have just established a revolving facility to accelerate health product introductions at scale. It was mentioned earlier, there is this sort of an obstacle to kind of get there in terms of breaking or de-risking in a way, the investment in facilitating the introduction of new products. So this is what this new mechanism is doing, and it has already allowed us to ensure the procurement and the early introduction of new bed-nets that are much more effective and much more affordable than the previous generation. So we're quite happy with that. We have also, with our partners, achieved lower sustainable pricing, therefore contributing to more equitable access for specific health products. So for example, lower costs for first-line ARV treatment for HIV, also breakthrough pricing reduction very recently on TB treatment and diagnostics. So really important to push that forward. And finally, and I'll stop there for this question, we've been also investing in accelerating the capacity building for regional manufacturing and procurement for rapid diagnostics. So we can talk about that a little bit in more details later. I'll stop there.
Thank you. This was a very helpful overview. Dr. Ndembi is online.
Hello.
Yes.
Thanks again for inviting the Africa CDC. I'm just going to quickly run through. I think some of the points have already been mentioned by the previous speakers. So basically, I think we all agree. I think the pharmaceutical and diagnostic manufacturing in Africa is still nascent. I think we all agree on that one. But it doesn't justify why we should have a self-resilient and self-sufficiency ecosystem for therapeutics, vaccines, medical devices. I think this is important when a pandemic strikes. I think COVID is a very good example where we didn't have access to commodities. I think this is important that we really push this agenda. So if you compare the current status, I think for therapeutics, we do have what we call the PMP, the Pharmaceutical Manufacturing Plan for Africa. That has been launched 15 years ago. I think we had already thought through all the processes that it excellently actually require that we push the agenda on that end. The vaccines, we launched it in 2021 during COVID. I think we came to the realization based on our analysis that 99% of the vaccines all used for childhood immunizations actually imported, even adult vaccination. Only 1% manufactured locally. It's unacceptable for a continent of 1.4 billion people. I think medical devices, diagnostic is the same picture. So if you compare those products, I think leaving probably the PPEs and others, medical assisted technology, we're not doing very good. For therapeutics, only 8 countries will account for 80% of production for the continent. And 600 manufacturers on the continent, only 10 are WHO PQ'd. I think that's something we need to push forward in terms of regulatory. So someone mentioned earlier already, I think one of the panelists, research and development and innovation. We should own it. I think working with CEPI and other strategic partners, you can see that we are moving towards really expanding our niche in terms of increasing research and development on the continent. Less than 2% of worldwide research projects are in Africa. Again, for a country of 1.4 billion is definitely unacceptable. We cannot own this, move this agenda of manufacturing, I think 60% by 2040 if we don't have this robust R&D ecosystem. So the next slide gives you a little bit of flavor of what we've learned or the progress made during COVID. When we launched this initiative, we had barely 5 viable projects on the continent. As we speak, there are 30 projects announced. Those are actually happening as we speak on the continent. But more importantly, all those projects are spread across the 5 regions of the continent. I think this is a very good development. As you also are aware, the WHO, Africa CDC, MPP, mRNA Hub in South Africa, which were actually a very important initiative, would be able to replicate the Moderna vaccines on the continent and being really a hub for several spots across the globe. I think it's a very strong signal sending that from the continent. On the left panel, as we speak globally, we only produce 0.1% of the vaccines, 0.1% globally. And we are 17% of the world population. I think it's important that we actually put those numbers into context. So the plan of the 60%, I think if you bring it down to 2030, we plan to produce about 400 million doses. And then by 2060, as we mentioned, 2040, about 950 or 1.1 billion doses by at least 2060 to meet those targets that we mentioned earlier. I think it's important that we look into this in terms of the regulatory environment, financing, talent development, tech transfer and IP, someone mentioned already that. I think infrastructure, how do we build that? Market shaping, working with Gavi, working with UNICEF, the Global Fund for Diagnostics. I think we're going to move this agenda forward. So there are several barriers that we need to look into. The tech transfer, I mentioned. The demand signal, how do we work with our partners? I mentioned earlier. How do we support the manufacturers? I think, again, one of the panelists mentioned that it's owned by the private sector. I think we need to be sure we provide domestic resources, we mobilize resources to support the private sector to drive this one, not just fill and finish, end-to-end, really, value chain, I think drug substance. The regulatory harmonization, the good news there, the Africa CDC DG met with the WHO DG yesterday on this same topic, on regulatory, and ensuring that we achieve at least substantive or a high number of manufacturers on the continent achieve WHO PQ to be able to tap into really the global market. So we're working on the cross-border trade, working with the AFCTA for free trade across the continent, moving goods, vaccines across different countries. There are 55 member states. You understand that you need to work around those challenges, legal and all those other challenges that will be required to have a sustainable market and ecosystem across the continent. So I think I might pause here just to say we just had a very interesting meeting a month ago in Marrakesh, where we're establishing a marketplace for local manufacturers. I think this is quite significant. We have also seen that most of our regulators, I think 5 on the continent, are moving towards achieving a maturity level 4. 5 are maturity level 3 now, but they are pushing towards maturity level 4. I think the regulatory environment is becoming more conducive. AMA is coming, really going to be fully operationalized. We're relying on AMRH for regulatory component. We actually provided seed funding the Institute Pasteur of Dakar at the tune of $45 million to support one of the RNA hubs, research and development, capacity building and talent development in the West Africa region. I think these are significant investment in addition to what we've received more recently from the European Union, and as well as mobilizing in resources within the continent, we drive this in addition to the political commitment from our champion for vaccines, His Excellency President Cyril Ramaphosa, to drive these 8 bold programs from the Africa CDC and then from the Framework for Action for Vaccine Manufacturing, Diagnostic, Therapeutics.
Okay, I think connection broke down, unfortunately. But I think we got the gist of we got an overview of what PAM has achieved so far, what has been done. So we'll resume now the little order of intervention that I made before. And I will ask Mr. Molnar that Gavi, the Vaccine Alliance, was created 23 years ago to access vaccine market failures and find ways to make sure that these vaccines reach in the populations that need them at an affordable price. So could you please share with us what Gavi has done to date to shape sustainable and healthy market dynamics?
Thank you very much. It doesn't help. So my voice is very loud, so we'll carry it. So first of all, Elena and Francesca, thank you so very much for having me here today to speak on behalf of Gavi. I think when I signed up, I didn't know it would be the confirmation impossible. Why am I saying that? Because I did not know how well informed all of the speakers have been about Gavi. So it would be very tough for me to, it's a hard act to follow after having heard Jackson, Enrico, and of course Marco. I know Francesca will get spoken, but she will at the end. So and Francois. So I'll try to stick to the facts I wrote on one piece of paper because I need to stick to the 5 minutes. When in fact talking about 23 years in 5 minutes is very, very challenging. And also the other challenge I have is, as you say in English, it's like preaching to the converted, right? So basically, all of you know, the importance of global health, why we're all here today, and what we've done. But I will try. So a couple of things, it will be a bit of history in 23 years. Will be some of the results, because I think the importance is not only what we're saying we would like to do, but what we actually have done. And some of the particularities of Gavi, and lastly, the importance of G7. But I do want to say that we have both Francois and myself collaborated on the play, and we're looking at the PDF document in printed, you've done a beautiful booklet. This should be the Bible that is used for global health. Right? So really congratulations on this, and I know Francesca Belli should thank you. Now, Gavi, so in the 1990s, as you said, there was an acute market failure. What exactly do I mean by that? So powerful vaccines were being rolled out, and the lower income did not have access to these vaccines. They could not afford them, or the manufacturers were simply not interested in producing them. Now, I was also looking and inspired at the Instituto Internazionale, which in English it would mean, I don't think it's right, the Global Affairs, Institute for Global Affairs, and then focused equality. So what exactly did Gavi do to address, that active market pricing to actually ensure that there is a focus on equality from a global health perspective? What that actually meant is we aggregated, on the one hand, the developing country demand, and on the other hand, ensuring that we do vaccine at scale. What that in turn resulted into, number one, the vaccine pricing doubled, the immunization coverage has expanded, and there was a viable market for immunization that was created. Now, what have we done in 23 years of resistance? So, as of now, there have been more than 1 billion children that have been immunized. Now, that, in the context, it means basically half of the world's children that have been vaccinated. In 23 years, once again, it's 1/8 of humanity. I think this is not, something to talk about very lightly. Also, in terms of life saved, it's approximately 17 million future deaths. I know that when Justin was talking about 500 million, I think, children in Africa vaccinated, so half of that 1 billion were vaccinated in Africa. In terms of what we're doing, some of the ways about the model, we work with the private-public partnership, as you know. The market shaping development, I think François was talking about it as well, both of our organizations, have focused on that, is to reduce the vaccine prices. I think staggering numbers. In the United States, the cost to have a fully immunized child with 11 life-saving vaccines is around $1,300, so $1,300. Whereas the price that Gavi manages to get raised anywhere between $24 to $28 for 11 vaccines. And the industry does respond. So that over the course of 23 years, with a reduction of about 25% in vaccine prices. Also, we started with 5 vaccine manufacturers in the year 2001, and they were primarily in the Northern Hemisphere, actually exclusively in the Northern Hemisphere. Today, there are more than 19 fully diversified between the Northern Hemisphere, Africa, Asia, and America. Now, talking about diversification and market shaping, this is where I have to pause, and I'm looking directly at Francesca, but also Marco Boccarelli, the Minister of Economy and Finance, because one of the concrete examples of this was the pneumococcal conjugate vaccine for the PCV. That was a financial mechanism that was created together with Italy, where Italy was not only the initiator, but the largest contributor, and incentivized other countries as well to follow through. To bring the much needed pneumococcal vaccine, which prevents pneumonia, to markets where in the past the industry was not simply interested in that. And not only did it have to do that, it had to very quickly, because you know, a vaccine takes about 10 years to bring to market. In this case, we're talking about 1 year. And so this financial mechanism was created, it was rolled out. It did sunset in the year 2020. But 10 years into its creation, the impact was very big, and not only in terms of lower vaccine prices and coverage with the PCV vaccine, but also more than 820,000 deaths occurred as a result. And again, pneumonia is one of the leading causes of deaths in young children. So thank you to the Ministry of Finance. Thank you, Italy, for having embraced an initiative which at the time nobody knew whether it would succeed or not. And the success is there. Now, building on the PCV initiative during the pandemic, in the year 2020, Gavi once again used that example that worked and built the COVAX AMC. So on the same idea to ensure that nobody, in Marco was saying, nobody's really left behind. And that was used to deliver more than 2 billion doses of COVID-19 vaccines in more than 146 countries. So I think that would not have been possible had it not been for the collaboration with over last year. And again, coming back to Italy, because we are in a beautiful role, in the year 2021, I think Marco said it, the Italian government had the global health summit together with the European Commission, where Italy was very strongly encouraging the world to support the rollout of the COVID-19 and not only initiative. Now, this is just one small part of what we've been doing over the past 7 years. So the other 2 components are the co-financing and the transitioning model that's done notable. So co-financing means that every single country that we work with, and so far we started with, we had 73, now we have 54. Each of those countries had the let's say they knew they had to contribute and co-purchase the vaccine, which meant that it instilled a budget discipline. It encouraged the ministries of health and ministries of finance to talk to each other and ensure that they know that one day, I think the Rachel on that screen, who said, well, it is not that our organization is forever, right? So one day, the idea would be that the countries are, self-supporting, and so that's exactly why we had that's where the transition from 19 countries have transitioned out of these But I think all of this is to say that none of it, like underlined, none of it would have been possible had it not been for all of your support. The strong and very tight collaboration with the G7, with the G20, for the report to the Internal G7 in January, but also the partnership models that we work with our colleagues from Global Fund, from CEPI, UNICEF, and WHO, the Bill and Melinda Gates Foundation, the government, and so many others, the civil society, of course, to get there. So for all of that, thank you, and commission is really to take a lot together. I apologize for overriding it.
No worries. This was very helpful. And so now I'm going to turn to Dr. Erdly Patel from CEPI, because CEPI works on vaccines too, although its portfolio expands to other health products in order to prevent future epidemics and pandemics. Could you share with us how CEPI is working on research and development, and how this fits into its broader goal of ensuring that everyone has access to the products and the health products that are needed to fight these epidemics?
Thank you. Good afternoon, ladies and gentlemen, and thank you for the invitation to join this esteemed panel and to address the really important stakeholders and deliverers of pandemic preparedness, which I view as biosecurity, who've joined the session today. So to answer the question, I think a lot of people are familiar with CEPI. I'm happy to put some more information in the chat, but in the interest of time, I will be brief. CEPI was deliberately created to fund R&D for infectious diseases, so viral vaccines, in particular for Lassa, MERS, Rift Valley fever, Nipah, chikungunya, Ebola, and then we added COVID-19 out of necessity, as a recognition that there wasn't a supranational funder in this space, and we were still waiting for vaccines in that area. I think it's been a really great model where it's been since our inception in 2017, we have expanded to include end-to-end developments. So anything from the benchtop science and the identification of the immunogens and sequencing for, say, a disease X, through to supporting and enabling manufacturing. And even most importantly, the I in CEPI stands for innovation, is that funding for innovations within vaccine and other medical countermeasures. So as you alluded to, Irina, CEPI does do vaccines only, but we also look at prophylactic biologics, so monoclonal antibodies in particular for some of our disease targets. So in terms of equitable access, it's central to everything CEPI does. We're not another public philanthropic partner. We receive funding from those, and our responsibility is to see a return on that public and philanthropic investment into CEPI to make sure that those medical countermeasures that we're supporting are available to populations when and where they're needed in a timely manner at an outbreak or to curtail an epidemic, regardless who can pay. And we saw with COVID-19 what happened where we weren't able to do that. I think we're getting better as we do that each time. I think I heard recently from Africa Union CDC that Africa experiences approximately 2 viral disease outbreaks every week. That's quite a lot, but we don't need to hear about them because public health measures and existing countermeasures are already being effective. So we need to focus on those things with pandemic potential, and that is a biosecurity risk. It's a global biosecurity risk. And also we try and convene those stakeholders, much like the Instituto Fari and Internazionale, to keep these things in mind. We know from history that public-private partnerships tend to deliver innovations faster than public and philanthropic only, who are still the largest funders for vaccines R&D and collectively hold the power to move the dial for equitable access. In terms of the R&D and manufacturing support CEPI does, we bake those kind of equitable access agreements into our contracts. We don't give money away unless we have some commitment to either geodiversification or priority access in times of need with our partners. Thanks.
Thank you. This was really helpful. And since we're approaching the time for our Q&A, I will ask the last round of questions to our panelists. So we'll start with you in reverse order, Dr. Urli Patel. Looking forward, looking at 2024 and beyond, how does CEPI intend to continue building partnerships and supporting African health product manufacturing capacity? And what do you think are issues that are necessary to address in order to achieve the 100 days mission, which was announced back in 2021. CEPI had it's part of its central work. So yeah, could you tell us more about that?
Yeah, the 100 Days Mission is owned by the G7. It's owned by all of us here today. And to answer the question specifically, there's nothing for Africa without Africa. What we're intending to do is more listening exercises, increasing our presence through local staff or partnerships with organizations such as PAVM, ABMA, AUCDC, with the help of our funders, which include Italy, who have been very generous to our mission. These listening exercises have gained insights so far about the involvement of outbreak response. I mentioned that earlier. It's indicating things like regional smaller scale manufacturing capability coupled with a clinical trials network might be a good idea. And let's not view region as geographical region. Let's look at it as an alliance of countries that work together. For example, during the Ebola Sudan and Marburg outbreaks, Racera in Italy produced small scale batches that were able to be deployed in Uganda within 80 days. That was a really great example, which we hope to showcase through the International Pandemic Preparedness Secretariat in what we can do. It's making that 100-day mission actually real. Finally, in terms of that listening exercise, it's also to think about things in a way that others want to see it. And I think one of the previous panelists, Eduardo, Dr. Costa mentioned gene and cell therapies. So instead of just saying we're just going to focus on investing in thermostability because we know that's an important thing for regions like Africa, let's have a look at this and think, well, should we also invest in cold chain infrastructure, because that would benefit access to vaccines in emergency outbreaks, because they might leverage an existing mRNA platform, for example, that requires that, but it also enables access to other things, to gene and cell therapies for cancer and diabetes and non-infectious diseases. And that's true health equity. And that's what we would like to achieve. Thank you.
Thank you. That's great. So I will then turn in reverse order to Edouard. What we know that Gavi, with the Africa CDC and other partners, is proposing or is working to propose an African vaccine manufacturing accelerator, which is supposed to support sustainable vaccine manufacturing on the continent. Could you please share a bit more about this initiative, what opportunities and challenges it presents, and what can be done next year under the G7 presidency?
Thank you. So, earlier, I will be much for now, because I think that will be myself standing between this panel and talk now. I was not going to do that. Who is important in this country? Always. So, you said it. So, AVMA, the African Vaccine Manufacturer Accelerator, once again, thank you, Italy. Why? Because it's based on the same model and the same concept of financial mechanism that ECB was done to basically ensure that it does two things. One, to create a sustainable African manufacturing base that contributes to a healthy global vaccine market, and two, improve the African pandemic and outbreak vaccine supply in the world. Now, it is to be set up as an instrument to support at least 4 vaccine manufacturers, and the goal is to once it's implemented, to have the African manufacturers roll out and export these vaccines globally. We're looking at about 800 million doses. Now, why did this come about and how did this come about? So the COVID-19 pandemic has unveiled, unfortunately, a new set of challenges for the countries. On the one hand, it exposed significant gaps in the global health security. And on the other hand, and also, unfortunately, the pandemic preparedness component. As a result of that, and I think I'm looking at Jackson, you were saying that only about 1%, I think it's about 0.1% of the vaccines that are in demand from Africa are produced on the continent. And so, you know, the time of the pandemic, all of these constraints, together with the export bans and the hoarding phenomenon that we've all witnessed, made it very difficult for the African continent to obtain life-saving COVID-19 vaccines. And so in response to that, the African Union, but also the G7, and most recently also the G20, they've all called for an international effort to improve the access to medical countermeasures. And the African Union set a very ambitious target of 60% of routine vaccines that these vaccines should be produced on the continent between now and 2040. So we have just about 17 years to make this happen. Now, I've talked about Gavi's market shaping experience of over 2 decades. And again, AVMA, this is where it comes in. Now, I've also mentioned that the ambition is, and the hope, I should say, is that these Africa-based vaccine manufacturers can and should export the vaccines worldwide. And Gavi is definitely aiming to purchase a large percentage of these vaccines as long as they are licensed by WHO. So this mechanism basically, I mean, you know, is into to bring a level playing field so that these new manufacturers can compete with the current 19 manufacturers that I've spoken about earlier. Now, once again, the question that you've asked, what can we do with the G7? I will not say what I think we should do. I think you said it, and actually even better, they say it's you've written it. So for those of you who are involved in the G7, and I'm looking at the various ministries and the President del Consiglio, and not only, it's all here. It's about the political commitment. It's about continued financial and political support, so that this very important topic continues to remain on the agenda, because once again, the timing is now, and yes, it does save lives. Thank you.
Great, thank you. And I will also ask Françoise, I think you have plans already. What will the Global Fund do to support regional manufacturing, and what is the added value that the Global Fund can bring to these efforts we have just heard about?
Absolutely, thank you. So perhaps just to say, we don't start from scratch, and that's the good news, because obviously over the past few years, we have supported efforts to diversify our supply base, which is obviously super important to ensure sustainability, but also security of the supply, and also to shorten the lead time, right? So we've been doing that for many years. And as we speak, we procure, I mentioned before, our pool procurement mechanism. So through the PPM, we currently procure nearly 70% of the essential medicines from Africa-based suppliers. So that's already a very important starting point. We've procured about 1/5 of an anti-malarial product from Africa-based suppliers as well, and about 1/10 of the bed nets against malaria. So that gives you an idea, but there is much, much more to be done, obviously, and we are very much committed to do that. So perhaps a couple of things. One is that we believe it's quite important to focus on regional manufacturing capacity in Africa. We are slightly concerned that if we go to local manufacturing capacity, then we will end up with a myriad of initiatives that are not going to be sustainable over the long term, which is not what we want. So we need to keep an eye on what is the model that is going to be sustainable over time, probably at regional level, and making sure that we make that work. Second, we are focusing on Africa for sure, in the same way that this meeting does today, and the G7 presidency is planning to do. It is where we observe the largest gap between the demand and the local capacities. And we've seen that for COVID, but obviously it's also the highest burden for malaria. 95% of the malaria burden in the world is in Africa. So there is really a very strong case for us to focus on Africa. And the other part of this, why it makes sense, is also the great ambition that we are seeing from African leaders, from the African Union, from the Africa CDC, and my co-panelists online mentioned a few aspects of that agenda, which is really really encouraging, and we want to be part of that and support. So we have, in that, what we are doing, we have identified 7 levers by which we think we can bring about change and make a contribution as Global Fund to this very important agenda of regional manufacturing in Africa. One is, I've mentioned that we are very large, one of the largest procurers of health products globally. So we want to leverage our Global Fund tenders to incentivize other additional suppliers to join and to become quality assured, and to meet the quality assurance standards, so that we can work with them and expand our bases, our supply base. So the supply close to the demand is one of the criteria that we look at when it comes to assessing the proposals that we receive as part of our Global Fund tenders. So that's one. The other one is really around engaging with the regional procurement platforms and consortiums. And it speaks about collaboration on forecasting. So the colleague from the Africa CDC mentioned the importance of sharing and building capacity in terms of market intelligence and so on. So that's really, really important. And we share procurement best practices. We collaborate on forecasting demand forecasting, and so on. So that's really, really important as well in terms of capacity building. The third level that we use is we support accelerated product qualification and country demand forecasting. And that's really important because the product qualification is the process that takes a long time. And anything that we can do, again, using our muscles as a large procurer of such products, and obviously our partnership with WHO and others, to try and accelerate such qualification processes, to accelerate the introduction of new products and so on. Fourth, regional regulatory framework strengthening and harmonization. It's been mentioned by the Africa CDC colleague. Really important. That is strong, but it's harmonized, because if it's not harmonized, then it creates all sorts of barriers for regional manufacturing on the continent. And alongside that, obviously, a coordination with partners and advocacy, also very important advocacy for technology transfer, leveraging our sort of convening power and connections with all the players in the field to make sure that that happens and sort of accompanies the efforts led by the continent. So perhaps just to highlight a couple of recent results as part of that plan. So perhaps the first one I would highlight is that in September, we launched what we call a pilot expert review panel for HIV rapid diagnostics tests manufactured in Africa. So why HIV? Because there is a huge demand in Africa, so we can sort of foresee the demand and ensure sustainability. Why rapid diagnostic tests? Because none of them are currently produced in Africa. And it's where we can make a huge difference very, very fast with no major safety risk, let's say. So it's really a good candidate for acceleration. So the expert review panel, convening independent experts convened by WHO, they are really looking at and assessing the potential risks and benefits associated with the use of diagnostic products that have not yet undergone the regulatory assessment. That, as I said, is really, really long and stringent. So we're trying to find a way to accelerate that process through the expert review panel. And that would allow us to really accelerate the production, the manufacturing of HIV RDTs in Africa. The other thing that we've done last week, we co-hosted a workshop for African pharmaceutical manufacturers in Maputo, Mozambique, alongside partners. And that speaks more about what I mentioned at the beginning, the sort of collaboration, in market intelligence sharing, coordination, capacity building, and most importantly, identify opportunities for greater partnership and how we can address the barriers that are preventing local manufacturing for manufacturers from entering the market. And then working very strongly also on our quality assurance policies to kind of reflect WHO changes and again try to accelerate those processes while keeping obviously an eye on the safety and security of the products, but accelerating their qualification to make sure that regionally manufactured products can be scaled up. So yeah, just to finish, perhaps it's really critical to sustain the momentum. There is momentum at this point in time, which is fantastic to see. So it's incumbent upon all of us to sustain it and really deliver a difference. Thank you.
Thank you. This was really comprehensive. And now I will open the Q&A session. And we have we are a little bit running out of time, but we have received a couple of interesting questions. And I see 2 questions. Maybe the panelists can join us again here on stage, because no, if you want, you can stay there and we can just bring the mic to you. So we have a question from Mr. Tetsushi Sonobe, Dean and CEO of the Asian Development Bank Institute. And he has a specific question on training and higher education. And I wonder whether Dr. Demby and maybe Jack as well can provide some inputs. The first question is, if you have any information about the training that students in African higher education institutions get so that they can actually contribute to achieving this goal and like be part of the production chain. And if you have any inputs on that, and you know, I guess if the numbers of trained people is low, what can be done, what kind of interventions and policies are needed to stimulate this training in higher education. And also he asked the difficulty, if you can share about if it is difficult to get people trained in Europe or North America in biomedical topics, and how easy or how difficult it is for them to get back to their own countries and contribute to this effort. So very broad question, very on point, because I know that I think training was in the health sector was mentioned under the Piano Mattei, one of the first drafts. So I don't know if anyone has any input. I saw Jack nodding, so I don't know if you have any inputs, or Dr. Demby or our partners from the institutions here.
Not sure if I'm audible, but...
yes, okay. We can hear you.
No, I think this is a very good question. We have, from our framework for action numbers, very clear that we need to train more people. We need workforce for vaccine manufacturing and other key pillars for essential commodities. I think we have a very simple approach, regional collaborating centers. I mentioned to you the $45 million to IPD to support the West African hub for research and development. And then that's very important. And the network actually includes universities, the regulators, and also the private sector in ensuring that we train a pool of African scientists that can actually be really valuable within the whole ecosystem, the end-to-end value chain. I think this is a plan from the Africa CDC for the 5 regions of the continent. We're also partnering with DCVMN, we are partnering with BARDA and other institutions to be sure that South Korea IVI, we have sent over 100 Africans to Korea to be trained. I think this is what we'll be doing in addition to the mRNA Hub, which is actually training a pool of scientists. I think there's a plan. It's a low-hanging fruit, and it's happening. Thank you.
Thank you.
Yeah, thank you. Demby has put it very well. There's a lot of, I am aware of South-to-South partnerships and learning across the academia, various partnerships. Demby has put that very clearly. I'm also aware about the South to North Luckily enough, I was involved in 2 major assessment and studies. One of them was Rwanda, a work in terms of establishing a vaccine manufacturing plant there, and also the work that was being sanctioned by Ghana to look at the viability of setting up, and that is where mostly we're dealing with the demand. But in those 2 countries, we did look at, just a bit of an assessment of the FDAs and some of the issues you have raised about the capacity of the human resource to be able to be involved in that. And I think Debbie has put it very clearly, the Africa CDC and the African governments are really putting that into place. The case of Rwanda was very clear, where basically they are able to source for a much more capacity in terms of learning and all that. And I think we did see a lot of South coming to Kenya, University of Nairobi, and also, again, looking at the partners, they were partnering the pharmaceutical, like in Germany. So you see a lot of South to South and North to North. So it is happening. I'm sure it's in the pipeline. And we are aware about regional manufacturing is not just a political agenda. Definitely it has a lot of a high-level political will from African government and from the various players, private sector, global pharmaceuticals and all that. But also at the same time, like Africa CDC's team has mentioned, there are practical steps that have been put to make sure that not only the setting up of those manufacturing plants, if I was to put it that way, but also the question of a capacity for staffing and all that. So it's an all-round, and I am aware that the various initiatives to look at the capacities and including students training and all that. Thank you.
Yeah, please go ahead.
Yeah, thank you. So I think, as I mentioned twice in my interventions, none of this would have been possible had it not been for the collaboration. And the one example, and I'm here with my colleague Françoise, is the collaboration in the space of health system strengthening that both Gavi and the Global Fund have been doing. The statement is that health workers are the backbone of well-functioning health systems. And so the reason I'm saying that is because in many of our investments, we will look at the bottom line. And so with very well-trained health workers, we can, at the community level, we can deliver all of these programs, whether that be access to HIV, TB, and malaria treatments or immunization. It all comes to the same bottom line. So I think this type of collaboration and not only will help address the training question that you just mentioned. And we have been already actively doing it because HSS, as we know it, is quite important. Over. Thank you.
Thank you. And I see another question that Dr. Urli Patel is replying to in the Q&A. So that was more about the challenges of academic training and development for human resources in the pharmaceutical industry. So I would rather refer to what Dr. Urli Patel is writing. Thanks. And I see question from Stefano Vella, works for Friends of the Global Fund and Unitaid and Medicine's Patent Pool. So we also cover Unitaid and Medicine's Patent Pool in our report. And his question is very on point. How it's important that these organizations are involved. My question then is how? How do you have any specific input? I know the Global Fund works with Unitaid. I was wondering also where the MPP comes in and if you have worked with them, both Gavi, Global Fund and CEPI. And yeah, how do you partner with them and how do you think they can be involved in these efforts?
I can start. Yeah. So the Global Fund is a partnership, as you know. So we work very closely with Gavi. We work very closely with CEPI. We work very closely with Africa CDC, and we work very closely with Unitaid, indeed. In fact, we share a building. We are neighbors in Geneva, and we have opportunities every day to collaborate on a number of issues. But more strategically, of course, with Unitaid, we sort of combine our efforts to see more of the end-to-end delivery system, if you wish, to support the development of new health products to fight HIV, TB, and malaria. So this is more what Unitaid does. and we work with them to then scale up the deployment of such innovative products in the poorest and the most vulnerable countries and communities in the world. So we work very, very closely together indeed to ensure that we cover the entire end-to-end ecosystem, if you wish. And it's been like that since our creation, really. So, and I'm sure others can also comment upon that, but very close partner indeed.
I don't know if you have anything else to add, or you just subscribe to what was said. Okay. And I see Dr. Erli Patel also writing her response. So we have 5 minutes left, though I think we will run over, and I don't see any other questions. So I will just thank you, all the panelists, and then we move back to the concluding remarks by Dr. Francesca Manno from the Ministry of Economy and Finance. Thank you.
Thank you very much, Irene. And I know we are late, and I'm standing between the refreshment that I think you will all looking forward, but I would like really to thanks for the invitation and to Istituto Affari Internazionali and Focus Equality for organizing this event, which I believe has really provided very interesting perspective and valuable food for thoughts. I don't think I'm supposed to summarize the discussion. For sure I cannot, although I took a lot of notes, but let me highlight just a few key points and give a preliminary overview of our thinking in the G7 finance track related to today's topic. And I wanted to stress these are very preliminary thoughts because we are still thinking about our priorities and deliverable. And let me start by saying that I found the EI paper particularly useful and well structured. I wouldn't venture to say as a Bible, but definitely as highlighted the benefits and the challenges faced by Africa in boosting health product manufacturing capacity. And most of the challenges have been recalled by speakers today, and I think there is a lot of concurrence on the list of the elements that we need to put in place to create a conducive environment to allow Africa to manufacture medical countermeasures that are really so vital to the well-being and health of local population. Just let me mention a couple. First, we require a predictable demand on the continent for the investment to be sustainable. Second, we require a regulatory system that is integrated and with appropriate quality standards. Third, we require technology partnership, which means that the industry should be involved. And there really a lot of progress that have been made in this area, and some are foreseen in the future. And I think one of the, let's say, positive elements of the COVID-19 pandemic was is really the acceleration given to many of these initiatives around expanding vaccine manufacturing, in particular in Africa. And we heard from the representative of CEPI Global Fund and Gavi the project they are working on, and these are really clear example of concrete action in this space. Of course, I am personally most familiar with the African Vaccine Manufacturing Accelerator, AVMA, IMC, by Gavi, and I believe this mechanism, by offsetting the initial cost and enabling a competitive entry into the market, can really unlock the African huge potential to develop a sustainable and diversified regional vaccine industry. Given our experience that was quoted by Edward with the PCV, the pneumococcal IMC, and knowing how risky the business of vaccine is, I think Rachel reminded us of that, we were quite cautious at the very beginning in wanting to, really rapidly venture in this endeavor. What convinced us to support this in the Gavi board were several factors. And first, the widespread recognition that there is really a limited window we have to maintain this political momentum, so we have to be quick. Second, also the shift of narrative from just an aspirational goal set by the Partnership for African Vaccine Manufacturing to concrete progresses in most of the interconnected areas, such as regulation. Mr. Costa told us how the establishment of the African medicine agencies is really a game changer. The support to capacity building, and I think here also the establishment of the pandemic fund can help in this. Vaccine procurement policy, Africa CDC, infrastructure investment, the involvement of the MDBs, African Development Bank, IFC, all they invest in this venture. And third, and really important to me, is this incredible effort that I see of collaboration among all actors. This is really crucial, and it should be sustained. It should not be lost. And because really I'm confident that if we continue this involvement, this will make this project a success. So we really have a lot, so much at stake that failure is not an option. So it's clear that supporting the establishment of a vaccine industry in Africa will have a lot of positive social, economic, and healthcare implications for the continent development. And from Italy perspective, these projects aligns well with our focus on Africa, our historic leadership in the health space, and in particular with the innovative financing mechanism and the PPR domain. And it can also encourage lines of collaboration with Italian industry, researcher, academia, regulator, and training institution. As Marco Giungi set very well the scenario in which we operate, and reiterate the fact that Italy is committed to maintain a focus on health. We did it in the past. I recall that in May last year, I was here in another event of the EI, and we were really worried already there about the loss of momentum. But at the end, we managed to achieve some fundamental progress, such as, for example, the launch of the pandemic fund in 2022 that was facilitated by the G20 Joint Finance and Health Task Force, which is co-chaired by the Ministry of Finance and Health of Italy and Indonesia. And Italy has been one of the main contributors to the pandemic fund. So for the future, to conclude, during our incoming G7 presidency, we really will aim to keep momentum, to build on the legacy of previous presidency that have worked on all these issues. And so we hope really to work with international partners and G7 countries to keep addressing global health challenges and advocate for a better global health architecture. Thank you for your attention.